Fibroid symptoms often start as whispers, easy to miss in a busy life. The most common sign? Heavier, longer periods that leave you drained and fatigued. Persistent tiredness can signal anemia from blood loss. Many women feel pelvic pressure or bloating, making daily activities uncomfortable. Frequent urination or trouble emptying your bladder can also be clues. Pain varies, sharp, chronic, or radiating to the back, and sometimes pain during sex. As fibroids grow, your abdomen may swell, making clothes feel tighter. These symptoms aren't just part of being a woman. They're real and deserve attention. Listening to your body's whispers is the first step to answers and relief. Don't ignore what your body is trying to tell you. Uterine fibroids are benign muscular tumors that develop in the wall of the uterus. They're extremely common, especially among women of reproductive age. But the good news is they're rarely dangerous or cancerous. In fact, many people have fibroids and never even know it, because they often cause no symptoms at all. Fibroids are made of the same smooth muscle tissue as the uterus itself. But instead of forming a uniform layer, these cells bundle together and grow in the wrong place, creating firm, rubbery masses. These growths can range dramatically in size, from as tiny as a seed to as large as a melon. Some women may have just one fibroid, while others can develop several at the same time. The number, size, and exact location of fibroids all play a role in what symptoms, if any, you might experience. Submucosal fibroids grow just beneath the uterine lining. Because of their position, they often lead to heavy or prolonged menstrual bleeding, and sometimes even fertility issues. Intramural fibroids develop within the thick muscular wall of the uterus itself. These can cause symptoms like pelvic pressure, pain, or a feeling of fullness in the lower abdomen. Subserosal fibroids grow on the outer surface of the uterus. When they get large, they can press against nearby organs like the bladder or bowel, sometimes causing urinary or digestive issues. It's important to remember that fibroids are not a sign of poor health, bad habits, or anything you did wrong. They're simply a common quirk of biology that many women experience. Learning about fibroids can help reduce fear, encourage open conversations, and empower you to make informed choices about your health. Most importantly, fibroids are almost always benign and manageable. With the right information and support, you can take control of your health and well-being. Why do fibroids happen? The answer isn't simple. Hormones, especially estrogen and progesterone, fuel fibroid growth. Genetics play a big role. If your mother or sister had fibroids, your risk is higher. Fibroid cells are extra sensitive to hormonal changes during your cycle. That's why fibroids often appear during reproductive years and shrink after menopause. Growth factors and certain genes also contribute, but it's not about something you did or didn't do. Anyone with a uterus can develop fibroids regardless of lifestyle. Understanding the causes can help shift the focus from self-blame to proactive management. You're not at fault. Fibroids are a mix of biology and genetics. A fibroid diagnosis can feel isolating, but you're far from alone. Up to 80% of women develop fibroids by age 50. Most never know it. Black women are more likely to get fibroids, often at a younger age and with more severe symptoms. By age 35, 60% of Black women have fibroids, compared to 40% of white women. Fibroids affect women from all walks of life: teachers, artists, CEOs. This is a widespread women's health issue, not a rare condition. Sharing your story can empower others and reduce stigma. Millions of women are on this journey with you. The prevalence of fibroids is a reminder. You're part of a global community. Support and shared wisdom are out there. Reach out and connect. While you can't control your genes or hormones, you can make choices to support your health. Eat more fruits and vegetables, especially citrus and cruciferous veggies. Limit red meat, which may increase risk. Stay active. Regular exercise helps manage weight and hormone levels. Vitamin D may lower risk. Ask your doctor about testing and supplements. Manage stress with mindfulness, sleep, or time in nature. These steps aren't a cure, but they create a healthier environment for your body. Focus on what you can control, not what you can't. Small changes can make a meaningful difference. A fibroid diagnosis is just the beginning. Treatment is highly personal. Every woman's experience with fibroids is unique, and so are the options available to manage them. Understanding your choices can help you feel empowered and in control of your health journey. If you have no symptoms, watchful waiting may be all you need. This means regular checkups to monitor your fibroids, but no immediate treatment. Many women live comfortably this way for years, especially if their fibroids aren't causing problems. For bothersome symptoms, hormonal medications or IUDs can help control bleeding and pain. These treatments don't remove fibroids, but they can make daily life much easier and help you manage symptoms while preserving fertility. GnRH agonists can shrink fibroids temporarily, often before surgery. These medications are usually used for a short time to make surgery easier or to reduce symptoms quickly, but they're not a long-term solution. Minimally invasive procedures like uterine artery embolization or focused ultrasound can shrink or destroy fibroids without major surgery. These options often mean less pain, shorter recovery, and a quicker return to your normal activities. Myomectomy removes fibroids but keeps the uterus. Hysterectomy is a permanent solution for severe cases. Your doctor will help you weigh the benefits and risks of each, especially if you hope to have children in the future. The right choice depends on your symptoms, age, and family plans. It's important to consider how each treatment might affect your lifestyle, fertility, and long-term health. Talk openly with your doctor. There's no one-size-fits-all answer. Ask questions, share your concerns, and work together to create a plan that fits your needs and goals. Jane, now informed, felt hopeful and ready to take charge. Learning about her options gave her confidence to make the best decision for her body and her future. Listen to your body, seek help, and remember, fibroids are common and manageable. With the right support and information, you can live well and thrive. Disclaimer: this video is for education only. Always consult your doctor for medical advice and to discuss the best treatment for your unique situation.